Let me introduce Mr. Corey Brown, a licensed acupuncturist, a diploma of acupuncture, and a Master of Science in TCM, a New Orleans native. He's a native from New Orleans and initially purchased Western medicine, but yearned to the holistic approach. Entangled by the natural remedy, he discovered traditional Chinese medicine through the mentor, leading him to study acupuncture and herbal medicine in Denver. The transformative journey confirmed his calling, finding the joy in his patient, improved health, relief of his own chronic issue through the holistic method. Coy is eager to share his healing knowledge, currently purchasing a doctorate degree of acupuncture and Oriental medicine, focused on the classic Chinese medicine. He's remain dedicated to his purpose as a healer. Let's welcome Mr. Coy Brown.
All right. Good morning, good afternoon, good evening, depending on where you're chiming in from on today. My name is Corey Brown, and I am a licensed acupuncturist and herbalist in Denver, Colorado. I am also a current doctoral student, finishing off the DAOM program at Colorado Chinese Medicine University. And I am excited to present to you today a presentation about evidence-informed treatments of chemotherapy side effects in Chinese medicine. And, I chose this field because I work with a lot of cancer patients. And, a lot of cancer patients are always looking for ways to offset the side effects, the debilitating side effects of chemotherapy. And so I feel like our field can really help patients as they go through that whole healing journey. So I'll begin with some of the basic knowledge, and then go into some research, and also present a few cases as well. So we'll jump right in. All right, so I'll be starting off with the psychosocial model, talking about the biological factors. So beginning with the chemotherapy side effects and everything. So chemotherapy targets cancer cells, but also affects healthy cells, leading to side effects. And some common side effects are nausea, vomiting, fatigue, hair loss, immunosuppression, anemia, and other side effects depending on the patient. There's also genetic factors. So patients' genetics can influence drug tolerances and susceptibility to those side effects. And then moving right along into psychological factors. So emotional well-being. So chemotherapy can lead to anxiety, depression, fear, and uncertainty about the future. And there's also some coping mechanisms. So patients may have different coping strategies and adaptability. And then we talk about quality of life. Psychological well-being can impact a patient's perception of their quality of life. Then social factors. So having a strong support system from family and friends and healthcare professionals can make a significant difference. And access to healthcare, financial resources, and insurance can affect treatment options. And then beliefs, norms, and values influence treatment decisions and complementary therapies as well. Then we talk about how chemotherapy side effects are addressed. So there's biological interventions such as medication, dietary changes, and symptom management. There's psychological support in the form of emotional support, counseling, and resources to address psychological impact. And then there's also social support, such as access to support groups, education, and practical assistance. And the exciting information is the TCM view of chemotherapy on side effects. So we talk about harmonizing qi and blood, which chemotherapy disrupts the flow of qi and blood, leading to fatigueness, weakness, and anemia. Then we talk about the yin and yang balance. An imbalance between excess yang and deficient yin results in symptoms such as hot flashes, dry mouth, and inflammation. Also, organ systems that's in focus. So TCM associates specific organs with symptoms, for instance, emotional stress affecting the liver, And as we know, that can vary depending on the patient. So different symptoms, different organs can be at play depending on the patient. All right, and then talking about the nurturing aspect. So as far as the treatments, acupuncture can help restore the chi flow, alleviating symptoms like nausea, pain, fatigue, and emotional distress. Herbal medicine, so personalized herbal formulations to address symptoms such as nausea, diarrhea, and immune support. And dietary harmony, balancing yin and yang through a thoughtfully selected diet using cooling and warming foods. And I'm a big proponent of the dietary aspect because some patients just, either can't handle herbal medicine or they're taking some medication currently that just don't mix well with the herbs. And so diet is an easy thing to kind of help recommend to patients that they can be doing every day to help themselves. And it also gives them a way to be part of the healing process as well. All right, in mind and body practices, something else that I recommend a lot in clinic. So qigong and tai chi, which offer gentle, holistic exercises that improve energy, mental clarity, and overall well-being. Because as we know, there's a lot of mental overthinking and stress, and just a lot of thought that's going on during this process for patients that are undergoing chemo and that have cancer. And so qigong and tai chi not only helps that mind, that mental aspect, calming aspect of the mental aspect, but also to help continue the flow of energy and healing throughout the body. Then moxibustion, utilizing moxa for warmth and chi promotion. It addresses cold-related symptoms. And then mindful well-being, which also kind of goes into the qigong and tai chi realm as well, incorporating meditation, mindfulness, and relaxation techniques to mitigate stress and support emotional health. And integrating TCM with modern medicine. And I feel like the majority of the time, this is what is happening, right? The patient is already going to their Western oncologist, getting treatment, and then they're coming to you to kind of help support that care, which is very important. So when we talk about collaborative care, this talks about engaging TCM practitioners while working closely with the oncologist to ensure a synergistic approach. So working together. Individualized treatment. TCM's patient-centered focus allows for tailored care to address specific needs and concerns. Complementary synergy. TCM serves as a powerful complementary therapy, enhancing the effectiveness and well-being of cancer patients during chemotherapy. All right, and so we're gonna move right along into some studies. I have like 4 studies. I'm not gonna go too much into everything that's on the slide, but just kind of give an overview of what each study was providing. So this talks about traditional Chinese medicine, diet, paratherapy for alleviating toxicity in chemotherapy and radiotherapy in cancer patients. And this was a meta-analysis. So the key findings was enhanced symptom management, hemoglobin improvement, enhanced quality of life, and also contributing to weight gain. So TCM diet therapy outperformed ordinary diets by significantly reducing chemotherapy side effects, including leukopenia, nausea, and vomiting. Notable increases in hemoglobin levels was observed in patients following the TCM diet, indicating a positive impact on blood health, enhanced quality of life, and then weight gain. TCM diet contributes to weight gain, potentially mitigating the weight loss common in cancer patients. And there was some certain limitations and need for future research. So for this particular study, the limitations were predominantly it was basically because this particular study predominantly involved the Chinese study population and certain methodological issues in the original studies they felt like may affect the outcome. So just needs for more variety of research in a variety of populations to kind of give a well-rounded view of everything. But overall, the results were positive for this case. All righty, and so this is, so the last one was talking about TCM diet. This is a particular research that supports Chinese herbal medicine for reducing chemotherapy associated side effects in breast cancer patients. This is a systematic review and meta-analysis. So as we know, breast cancer treatment typically involves a combination of approaches, including surgery, chemotherapy, radiation therapy, hormonal therapy, targeted therapy, and immunotherapy. Each of these methods are chosen based on the stage characteristics of the cancer. Chemotherapy is widely employed in treating both early stage, invasive, and advanced stage breast cancer, and it is sometimes used as a neoadjunctive therapy to reduce the size of tumors before surgery. Chemotherapy plays a crucial role in destroying cancer cells and improving patient outcomes. As far as the side effects, despite its effectiveness, chemotherapy often leads to adverse effects, which can significantly impact the patient's quality of life. Common side effects include nausea, vomiting, diarrhea, constipation, alopecia, hair loss, myelosuppression, and impaired immune function. The severity and occurrence of these side effects can vary widely based on factors such as the chemotherapy regimen used, the dosage, the duration of treatment, and the patient's overall health. The variability underscores the importance of developing strategies to manage and alleviate chemotherapy-induced side effects. Then, as far as introduction to Western medicine has sought to address these side effects with drugs like dexamethasone, 5-HT3 receptor antagonists, glutathione, magnesium sulfate, and calcium gluconate. However, these approaches may not fully meet the patient's needs, leading to search for additional adjuvant treatments. All right, and so talking about the efficacy of Chinese medicine in alleviating the side effects, Chinese herbal medicine has gained clinical acceptance as a valuable approach to mitigate chemotherapy side effects in breast cancer patients. The use of Chinese medicine often complements conventional therapies and offers unique benefits. Existing systematic reviews and meta-analysis have explored the impact of Chinese medicine when combined with conventional treatments, including surgery, chemotherapy, or endocrine therapy for breast cancer. These studies have primarily examined tumor response, quality of life, and reduction of hot flashes. But there is a need for comprehensive study. Some earlier reviews have provided inconclusive findings due to limitations in available data. There was an opportunity to conduct a more comprehensive meta-analysis by collecting as many relevant studies as possible and focusing specifically on evaluating the effects of Chinese medicine in managing chemotherapy-induced side effects. This study finding was that the meta-analysis outcomes demonstrated that patients receiving different Chinese medicine treatments experienced significant improvements in side effects such as chemotherapy-induced nausea and vomiting, diarrhea, alopecia, and myelosuppression. And some additional side effects that they talked about, they may experience are like hot flashes, kidney and liver injury, and cardiotoxicity. And then there was some focus on gastrointestinal side effects. And then they brought in some utilizing particular herbal formulas for the treatment of breast cancer. And so this particular formula, Yiqi GNP Hilwei, therapy alleviated the occurrence rate of severe constipation, even though the difference wasn't statistically significant. And then looking at the alopecia, which we know chemotherapy has one of the major side effects is alopecia in certain patients. This meta-analysis included studies examining the effects of Xiao Yaping, and Fuzhong Qingdu on reducing alopecia caused by chemotherapy in breast cancer patients as well. All right, so that was one particular study on Chinese herbal medicine focusing on breast cancer. This is also a Chinese herbal medicine study focused on the myelosuppression induced by chemotherapy or radiotherapy. This is also a systematic review of randomized controlled trials. So when we look at the Chinese herbal medicine and cancer treatment, this particular study involved 646 articles that were retrieved following a comprehensive search strategy. The demographics were 818 subjects with various types of cancer, and the focus of this study was to assess the effects of Chinese medicine combined with chemotherapy, radiotherapy on various blood parameters in cancer patients. The random control trial involved patients undergoing chemotherapy, radiotherapy in combination with Chinese medicine or without Chinese medicine. Different blood parameters were examined, such as white blood cell count, red blood cell count, hemoglobin, and platelets. Chinese medicine significantly prevented white blood cell damage by chemotherapy and radiotherapy, with relevant statistics and figures to support this finding. In the conclusion of this particular study, Chinese medicine has a significant protective effect on white blood cells during chemotherapy and radiotherapy in cancer patients. There is a need for further rigorous, large-scale, random control trials to explore Chinese medicine potential benefits in preventing other blood-related side effects. So that was another one kind of using more of previous knowledge to compile to kind of see where those gaps were and where further research was needed, but it also showed positive, promising results for Chinese herbal medicine in our field. And this particular research was based off acupuncture. So one about diet, two about Chinese herbal medicine. This talks about acupuncture for the prevention of chemotherapy-induced nausea and vomiting in cancer patients, a systemic review and meta-analysis. So chemotherapy-induced nausea and vomiting is a common side effect during cancer treatment. There is a significant desire in finding effective interventions to alleviate chemotherapy-induced nausea and vomiting symptoms and improve the quality of life of cancer patients. This systematic review focuses on the role of acupuncture as an intervention for chemo-induced nausea and vomiting. The key findings were that acupuncture, in addition to usual care, showed a notable positive effect on controlling chemotherapy-induced acute vomiting and delayed vomiting. This means that when patients received acupuncture alongside their standard care, they were more likely to experience relief from vomiting triggered by chemotherapy both immediately and with a delay. However, the results did not demonstrate a significant effect of acupuncture on chemotherapy-induced acute nausea and delayed nausea. While it was effective in controlling vomiting, it did not appear to be as effective in reducing feelings of nausea following chemotherapy. In comparison with sham acupuncture, the results did not show any effectiveness for acupuncture in the review outcomes. This suggests that the benefits observed may not be due to specific acupuncture treatment, but rather other contextual factors. It's important to note that certainty of evidence was generally low or very low, indicating that more robust research is needed to draw definitive conclusions. And some of the recommendations, because I'm not going to really go through too much of the particular study content, that I have listed here, but just this particular study was to show that we do need more research in the field, even though that acupuncture shows promising results. So as far as recommendations, efficiently conducted meta-analysis would greatly benefit from an agreed core outcome set for chemo-induced nausea and vomiting, reducing research waste, and improving data interpretation. Primary studies should provide more information on the effects of acupuncture in specific clinical scenarios such as chemo-naive patients, those with a history of poorly controlled chemo-induced nausea and vomiting, or those experiencing chemo-induced nausea and vomiting despite appropriate use of antiemetics. Researchers should consider collecting contextual information such as the patient-practitioner relationship and patient expectations to better understand the nonspecific effect of acupuncture. It is essential to investigate the moderating effects of acupuncture based on emetic risk of chemotherapy, the effectiveness of antiemetics, and the use of rescue medication. With no significant effects of predefined moderators were identified in this review, they remain important predictions and should be explored in future research. And so basically, this just kind of shows it really is has been difficult for them to do studies on acupuncture in general because of the inability to do blind treatments, like the inability to blind treatments, I should say, blind treatment providers, which can induce introduced by it. So definitely anybody out there that's interested in contributing to more evidence-based acupuncture treatments and chemotherapy side effects, it is definitely needed. And so now I'm going to talk about a few cases of my own patients that I've worked with that have had cancer and that have come in for treatment for the side effects. So this particular case involves a female that's age 63. This was done last year in August. She wanted support for pancreatic cancer, got diagnosed 2 years ago. She received some chemo and had surgery to remove the tumor back in August 2021. She found out recently that the cancer returned in the same spot and some nodules had spread to the lungs and stomach as well. Chemo wipes her out for 3 days with nausea, vomiting, and diarrhea. She has knee pain on the right knee, also has stomach pain on the left side of the abdomen, slightly above the navel. She also has pain in the lower abdomen around due forward point when laying on her back for too long. She would like to support her body before receiving chemotherapy on the next day. So after, doing her pulses, because predominantly using this intake information in her pulses, this is how I came up with my diagnosis. The pulse diagnosis was Mingmen fire decline. And this basically, I study classical Chinese medicine currently in my doctoral program. And so this was utilizing a technique of finding what was most significant. So finding the most significant pulse out of all of the pulses and going after that to kind of help treat that and help the body to overall balance itself. And so in this patient, the Mingmen fire was deficient. So the goal was to tonify Mingmen fire. These are the points I use. I used a few T's, which is also based off the Tang Ye method of also treating the body from that specific significant aspect that needs to be treated. So with this, the results, the Yuan Lo technique was applied to tonify Mingmen fire. Some other points were added, such as Ren 4 to supplement Mingmen fire more, and stomach 36 to assist with tonifying qi and reducing nausea, vomiting, and diarrhea. The fire and water tea were combined and prescribed to continue to tonify Mingmen fire. When the patient returned for her next appointment, she felt like treatment helped because she wasn't nauseous going into chemotherapy like she normally is. She did throw up after eating after the chemotherapy session, but it didn't last as long as it usually does. Case 2, also working with a female that was 53 years old. This was back August 16th, 2022, so also last year. She came in for immune support and support for chemotherapy side effects. She has a Western diagnosis of cervical cancer, stage 4. She was currently experiencing lower back pain and quad pain on the sides. She has also been feeling very fatigued. She also had been having pain below the left scapula. When she came in, her energy was a 1 out of 10. Body temp, she runs hot sometimes, according to her husband. She experiences some high-pitched tinnitus several times a week. Tongue had cracks, red especially on the tip, sticky coat. So the left side of the pulses were thin and thready, and the right side was also slightly thin and thready. The diagnosis was qi and blood deficiency with underlying liver yin deficiency. So the treatment principle was to tonify qi and blood. So I applied moxibustion when the patient first came in because she talked about feeling kind of faint, even though she had eaten. So I did that first to help build up qi that could be utilized for the treatment. And then I used points lung 9, stomach 36, and Ren 6. So not too many points. Attempted to do Zhuanzhong on Ren 15, which is a technique where there's 2 needles and 1 point at an angle to help to kind of regulate the middle jiao and balance the wood and earth elements. But the patient was very sensitive and felt pain, so I did not do that point. But I also sent her home with ear seeds in the shoulder and scapular area to assist with the pain. After the treatment, the patient felt like her energy went from 1 out of 10 to 7 out of 10, and she was more clear-headed. When the patient returned for her next appointment 2 days later, she reported that she had more energy than she did when she came in for her previous treatment. She still experienced some fatigue. Once she starts to walk, she'll feel like she needs to sit down again. She reported that the pain beneath the left scapula was a little bit better. She feels like the ear seeds have really been helping with the scapular pain by pressing them. And that's something else I like because I'm all about empowering the patient to be a part of their treatment process. So giving them the ear seeds, once again, that gives them something to do, but they also have that available to them consistently on a consistent basis to help them with their discomfort. And the last case, this is more recent, a male, 45 years old. This was last month, or 2 months ago, September. The patient wants continued support for neuropathy in hands and feet due to chemotherapy. The patient is recovering from stage 4 cancer, colorectal cancer. He has undergone the most aggressive chemo treatment that his Western physicians can give him. They have surgically removed some of the big cancer that could be removed, but he still has some of the cancer present in his lungs and his abdomen and intestines. His most recent PET scan has shown that the cancer is growing. He was told the past Monday that he couldn't start the stronger chemotherapy that was recommended for him because his white blood cell count was too low. Today, his energy was very low, 2 out of 10, and his digestion has been upset the last few days, manifesting with nausea and bloating. He thinks the digestion is messed up because of an aloe decoction that he had been drinking, that his partner had been making for him. His bowels were soft and sticky, tongue slightly dusky coat in the center, crack in the center, pale patches on the side and tip. Left side pulses, left sum was the most deficient, but pulses were overall deep and weak. On the right side, pulses were overall weak and deep. Diagnosis, once again, I included 2 aspects here. So in the system of the classical Chinese medicine I study, and also on the right side, TCM. So on the left, fire deficiency, meaning his left sum was the most deficient. So I focused primarily on tonifying fire. But then on the TCM side, Qi and blood deficiency. And then so the treatment principle was to tonify fire, tonify Qi and blood. So those were the points I used. I used Moxa and also acupuncture together. Dietary, I acknowledged him to reduce aloe, cold foods, and raw veggies from the diet, increase cooked foods, cooked vegetables, and warming foods, and I recommended ginger tea for the nausea. So this is a little bit more about what I did. So I applied moxibustion first before I even started the treatment to help tonify the qi because his energy was so low. So to build up a little qi first to see if there was qi to work with. After the moxibustion, I applied the Tangye method to tonify fire. After the treatment, his pulses felt much stronger and his left sum pulse rose up in balance. The pulse reported that he felt like his energy was much higher after the treatment. Upon returning for the next treatment, he reported that he noticed after trying ginger for a few days, he went from having loose stools and having bowel movements multiple times a day, which he was having bowel movements, he was losing count, to a few times a day, and his stool was now much more solid. So those are my references. And so basically that was my experience with working with cancer patients. I do work with a lot of cancer patients, and it shows very promising results, kind of help really treat the body from the root. Because as we know, one thing that we really stand out in is giving a more personalized, individualized approach to patients' treatment versus treating them all the same with the same protocol. So that's very important to help really make sure the qi in the body is balanced at the root so the body can really fight off what's happening in the body. So if you guys have any other questions on anything I spoke about, any techniques that I may have not went into more detail on, feel free to reach out to me. Here's my contact number, email address, and website as well. Feel free to reach out to me, and I'll be happy to talk with you in more detail. So I hope everyone enjoyed what I had to present today. Hope some of you may be moved to contribute more to this field of study. And hopefully I may meet you all virtually or in person in the future. Have a great day.
The evidence-informed treatment for chemotherapy and their side effect with the Chinese medicine is real deep research about the evidence-based medicine and in acupuncture and herbal medicine treating, especially for the chemotherapy, the side effect. In this presentation is a wonderful example for the new generation who studied in the native in the United States and get great skill to harmonize the patient chi and restore the yin and the yang, the balance, for restore the energy for the people who have a side effect of a chemotherapy. This plus the qigong and the tai chi and the herbal medicine and the dietary Chinese medicine. Such a wonderful presentation. And thank you, Mr. Brown, for this presentation. And furthermore, and in the social factor, and Mr. Brown have a point out is the social well-being and the psychological well-being in the people with the chemotherapy. That's a real part for the Chinese holistic and the integrative the medicine to be a heal, to heal the people, to heal the whole people who suffering the chemotherapy and with their side effect. Again, thank you, Mr. Brown, for such a wonderful presentation. Thank you very much.